The member for Kenora-Rainy River.
Thank you, Speaker. Since I was first elected in the fall of 2011, I spent a great deal of time focusing on the healthcare needs in northwestern Ontario. Through speaking with people at events and private meetings and a series of healthcare town halls that I hosted with my party's healthcare critic, Madame Jelena, last fall, it has become abundantly clear that the needs of the people in the Northwest are not being met. Many of the challenges have been created because the government still refuses to recognize that a system that is designed in and may work for the South is inadequately designed to meet the challenges of those of us living in the North. While there are countless challenges facing us in the Northwest, one of the most pressing is timely access to home care, which is what today's motion from the member from London Fanshawe's focuses on. It's a priority for us because it is an essential piece of the healthcare puzzle, which yields a positive return for both the patients and the healthcare system, and because it is one piece of the system that we can fix almost immediately through strategic investments. Not only is keeping a person healthy and in their home longer good for the overall health of the patient, but it costs the healthcare system significantly less money than it would to treat a person with non-emergent symptoms in a hospital bed, long-term care, or emergency home. It is a system that, when it's functioning properly, can yield fantastic results for Northerners, particularly seniors who may otherwise have to travel in order to receive the important healthcare services that they deserve. People living in the North don't have access to the same convenient healthcare options that people do living in Toronto. Many people, in particular seniors, live in outlying areas where the nearest hospital or emergency room may be a half an hour, 45 minutes, or even an hour's drive away. They're being prescribed the services, but when it comes down to it, they aren't receiving home care services, and I've heard of this neglect in every single community across my riding. And it's one of the priorities that the vast majority of the people in my riding have identified as their top priority on the pre-budget surveys that I've sent out across my riding. Waiting 6 months for services that are needed immediately simply is not acceptable. And fixing the problem requires only a very modest investment, which is really just the redistribution of funds on the part of the province. As my colleague from London Fanshawe pointed out in her address, the economist Don Drummond found that more than $1 billion in potential healthcare savings can be found simply by doing a more effective job of managing the system. So by improving access to home care, the overall costs of providing many more expensive acute care services will be reduced, resulting in cost savings for the province. These are very simple and achievable steps that can be taken to ensure that no one waits more than 5 days to access the home care services that they need. We have identified them. Now we're asking the province to implement them. Thank you.
Thank you.